Once 7 days injectable insulin treatment ends up being protected, successful in individuals with type 2 diabetes. Treating individuals with type 2 diabetes with another once 7 days injectable insulin treatment end up being protected and as powerful as day-by-day insulin infusions, as per the consequences of 2 worldwide clinical preliminaries distributed online today in Diabetes Care. The investigations propose that the once-week-after-week treatment could give an advantageous option in contrast to the wait of day-by-day insulin shots for diabetes patients. Beginning and keeping up insulin treatment stay a test for a great many patients worldwide with type 2 diabetes. Dread of infusions and the bother and wait of injectable treatment add to the obstructions against insulin treatment commencement and adherence. The adequacy and security of continuous insulin treatment are likewise exceptionally subject to different variables, like the precision of measurements, timing, and glycemic targets. Medical services suppliers accept that diminishing the recurrence of therapy organization with propels, for example, the once week-by-week insulin utilized in these stage 2 preliminaries, may diminish the hesitance to start insulin treatment while improving long-haul adherence, glucose control, and at last, patient prosperity. Insulin, which has been the establishment of diabetes treatment for a very long time, is a compelling glucose bringing down specialist and is protected when utilized at the right portion. Insulin treatment is difficult, requires successive infusions, and keeps on conveying a specific shame. The improvement of a viable and safe insulin that can be controlled once 7 days is a tremendous development in the field. Lingvay, who is an advisor for Novo Nordisk, is the lead creator of one of the examinations, which included 205 patients from 7 nations, the US, Croatia, Germany, Hungary, Poland, Slovakia, and Spain. The clinical preliminary comprised of a 14-day screening period, 4 months of treatment, and a 5-week follow-up to assess 3 unique approaches to change and upgrade the insulin portion and figure out which one introduced the best harmony between viably bringing down glucose while limiting low glucose occasions. Metformin forestalls pneumonic or lung irritation in creatures tainted with SARS-CoV-2. High extent of individuals with diabetes have persistent kidney infection, research uncovers. Analysts foster promising undifferentiated organism treatment to treat type 1 diabetes. She likewise is a creator of the second investigation that included 154 patients from 5 nations, the US, Canada, the Czech Republic, Germany, and Italy. This preliminary followed a similar 23-week time period and assessed viable parts of insulin use just as the most ideal approaches to progress from an everyday routine to the new week-by-week insulin infusions. The specialists confirmed that beginning with a higher first portion, called a stacking portion, permitted patients to arrive at their ideal glucose target quicker. These 2 examinations filled in as the stepping stones for a huge Stage 3 clinical preliminary program that is presently continuous at UT Southwestern and different locales, which is intended to assess the adequacy of once week-by-week insulin organization in patients with either type 1 or type 2 diabetes, Lingvay says. A week-by-week insulin is a distinct advantage that will diminish the treatment trouble for patients while likewise improving consistency. This treatment will likewise diminish the weight on the individuals who care for patients with diabetes requiring insulin. For instance, for patients who need assistance infusing, those living in long-haul care offices, and those with memory issues, a once week-after-week insulin will work with treatment and lessening the weight on the consideration suppliers.